Hello everyone. Now we will briefly discuss about the cell cycle and its regulator, as this is very important to understand what are the factors that affect cell cycle and what are the factors that promote the cell proliferation. Cell cycle has mainly four phases: G1, S phase, G2 phase and M phase. Normally cell is present in a quiescent stage known as G0 phase. After the growth factor, the cell enter into the G1 phase. In G1 phase there is duplication of the centrosome as a main event of this phase. In the next phase, S phase, there is chromosome duplication and there is a G1S checkpoint between these two phases. Here there is a check for DNA damage. If DNA of this cell is damaged, then there will be no cell division beyond this stage. After the S phase there is G2 phase, and after the G2 phase there is an M phase or mitosis phase. Between G2 and M phase there is another checkpoint, G2M checkpoint. Here cell look for any damage or unduplicated DNA. In that case, if there is an unduplicated DNA, cell cycle progression is arrested and there will be no cell division. Main cell division occur in M phase and mitosis. There are some cell cycle components and their function we will see. There are two types of main factor that we are going to discuss: one that promotes cell proliferation and one that arrests cell proliferation. First is cyclins and cyclin dependent kinases. For example, CDK4 and cyclin D. They phosphorylate RB gene and thus inactivate RB gene and allow cell to progress through G1S restriction point and will result into the cell proliferation. Another category is cell cycle inhibitors. They basically inhibit cyclins and cyclin dependent kinases. There are two categories of cell cycle inhibitor: CIP and KIP family, namely P21 and P27. P53 is a tumor suppressor gene which stimulates P21. P21 is a cell cycle inhibitor. TGF beta gene stimulates P27. P27 is also a cell cycle inhibitor. Another category of cell cycle inhibitor is INK4 or ARF family. INK4, also known as P16, binds to cyclin D and CDK4, which inhibit the phosphorylation of RB gene. So there will be no inactivation of RB gene and active RB gene will result into the cell cycle arrest. In INK4 ARF family, there is one more factor, P14 or ARF. They inhibit MDM2. MDM2 basically decreases the level of P53. So due to the degradation of MDM2, there is increased availability of P53. P53 regulates the cell proliferation or inhibit cell cycle progression. Cyclin dependent kinase inhibitors. P21 P27, P57, they inhibit multiple cyclin dependent kinases. P15, P16, P18, P19, they selectively inhibit only CDK4 and CDK6. CDK stands for cyclin dependent kinases. This is a combined diagram which shows the various phases of cell cycle like G1, S, G2, M, and two checkpoint G1S and G2M. Arbigine act as G1S checkpoint. Once activated, arbigine inhibit or stop cell proliferation at G1S checkpoint. Here we can see cyclin dependent kinase 4 and 6 in G1S phase along with the cyclin D. After this cyclin dependent kinase 4 and 6, there is cyclin dependent kinase 2, which has an important role in S and G2 phase. After cyclin dependent kinase 2, there is CDK1 in G2 phase and M phase. Cyclins help in activating cyclin dependent kinases, and they have important role or sequence in a specific sequence. First, cyclin D activates cyclin dependent kinase 4. Cyclin E activates CDK2. Cyclin A activates CDK2, and cyclin V activates CDK1. As we have discussed, cyclin dependent CDK inhibitors, there are two categories. One is broad inhibitors like P21, P27 and P51. They inhibit all the cyclin dependent kinases. And a selective category of cell cycle inhibitor, namely P16, P15, P16, P18, P19, they selectively inhibit only CDK4 and CDK6. So the sequence of appearance of cyclin dependent kinases is 4, 2, 2, 1, and sequence of appearance of cyclin is D, E, A, B. So this is a brief about cell cycle and its regulator, as they have played a very important role in to understand what are the factors or genes affect cell cycle and how they affect cell cycle. Thank you.